Hi, Dr. Eric Desman here. Today we're going to continue our myth-busting series and we're going to talk about breast augmentation and breast implants. And the first myth that we're going to bust is that breast implants always look fake, and that just isn't so. The way we approach breast augmentation surgery in our office is we use a system where we measure your tissues and custom fit the implant to your tissues. And when we match your tissues up with the implant that can fit your tissues, that's how we get a nice natural result. So implants don't have to look fake. So the next myth we're going to bust is that implants always feel fake, and that just isn't so. With the new technologies that are available today, we even have special types of saline implants that have a very natural feel because they're structured saline implants that have multiple shells on the inside that give them some body, and they actually feel very natural. And then of course silicone implants feel virtually identical to natural breast tissue. So just because you have an implant doesn't mean it will feel fake to the touch. So the next myth that we're going to bust is that you won't be able to breastfeed after getting breast augmentation surgery, and that just isn't so as well. And the way that we do surgery is that the implants are put either underneath the muscle or completely underneath the breast tissue over the muscle, but in either case the breast tissue itself is not disrupted, so your milk ducts are intact and you should be able to breastfeed after breast augmentation surgery. Now, another common myth that we need to bust is that breast augmentation will fix drooping and sagging breasts. And unfortunately, if you have too much droop and sag because of loss of volume after breastfeeding or after weight loss, then you may need a lift. And a breast augmentation surgery can't give you a lift that corrects the sagging like a true breast lift or mastopexy can do. Now, sometimes you need to do a combination procedure with an implant to get volume and a lift to reposition your nipple and areola. But that really depends upon your exam. But implants alone and breast augmentation alone cannot fix sagging breasts. So one of the most important myths that we have to overcome is that breast augmentation surgery is extremely painful, and that is not the way it works in our office. And the reason for that is that we use a rapid recovery breast augmentation process where most women are able to get back to normal activity, sore but functional, 24 to 48 hours after surgery. You'll have no special bras, no narcotic pain medications, no pain pumps. The way we approach the surgery allows you to get back to normal activity very quickly without a lot of pain. Now, another myth that we commonly encounter is that people think that only young women in their 20s can get breast augmentation surgery. And the majority of my patients are actually in their 30s and into their 40s when they get breast augmentation surgery. Now, I do take care of some younger women as well, but a lot of times women wait until they're done having children and they want to kind of restore some of that youthful appearance, and that's when we get to the breast augmentation surgery. And that can happen into the 30s and even into the 40s and even later. So it's not just young people who get breast augmentation. So the final myth that we're going to bust today is that implants need to be replaced every 10 years. And there's an old saying, if it ain't broke, don't fix it. And that's the way we approach breast augmentation surgery as well. If your implants are doing well, we leave them alone. Many patients are able to have implants last 15, 20 or longer years. And so with breast implants, if there's not a problem, we do not recommend replacing your implants at any specific time frame. Now, if you have silicone implants, the FDA does recommend that you get them checked for a leak 5 to 7 years after your initial surgery with either an ultrasound or an MRI, and then every 2 to 3 years after that, check with an ultrasound or MRI to look for a leak once again. But if they're doing fine, we just leave them alone.